more important points today because we are talking of life after COVID. And what are the 10 points? They are known as appropriate COVID lifestyle behavior, 10 S to be remembered. What are these 10 S? Besides the universal precautions, which we are talking for last 2 years, like social distancing, face masking, frequent hand washing, and respiratory hygiene. The first S is very important. Stress management. Don't get panic. Don't make this pandemic as a fear pandemic or a chaotic pandemic or a confusion pandemic or an anxiety pandemic. Because by becoming more anxious, you liberate some jittery molecules in your system, what we call epinephrine and norepinephrine and steroids, which further reduce your immunity. And you get malignant form of COVID. Be calm and face it and treat it to the best of your capability with the help of a specialist. Early treatment. Number 2 is sedentary lifestyle. Please, I use the word move it or lose it. All the time remain in motion when you are mild or moderate COVID. Keep on doing your activities, whatever you are doing. Don't be confined to bed. And number 3, self-hydration. Adequate amount of fluids, at least not less than 2 liters, until unless it is contraindicated. For example, if you have a CKD or you have a heart failure, please take the help of a doctor. But if you are young, self-hydration is a need of the hour. Most of the people in India are dehydrated. They don't consume much water. And that's how they get more clotting formation. It has been reported in one of the studies from Raipur that in summer, there is a higher prevalence of heart attack because people are mostly dehydrated. It's severely hot. So that may cause clot formation. Number 4 is also as smoking. Please stop smoking. If you are smoking, if you are a smoker, stop it today. Otherwise, you will definitely fall victim to a vascular insufficiency any time in your lifetime with COVID or without COVID. The vascular insult takes place in the small capillaries and arterioles and big arteries and may produce heart attack and lung attack and brain attack and every attack possible. So please condemn the use of smoking. There is not a single benefit. Today we smoke a cigarette, tomorrow cigarette will smoke. Today you chew a tobacco, tomorrow tobacco will chew. I always say smoking cigarette means climbing a slippery slope. You have to slip. The question is some little early, some little late. It's a slow motion suicide and a slow motion poison. Please quit smoking now before it's too late. 5th, saturated fat. The people who take saturated fat, they are more vulnerable to clot formation. Their cholesterol get oxidized, LDL, and it causes injury in the endothelium and make it rough. So more clot formation takes place. 6th, salt consumption should be less because this virus affect angiotensin converting enzyme, which are distributed in our system. So people who have a high cholesterol or hypertension, they have more comorbidities with this virus. So our objective is, if you are on ARBs, continue ARBs. It mitigates the severity of the COVID. Similarly, if you are on statins, continue statins. It also mitigates the severity by anti-inflammatory action. And if you are on anticoagulants or antiplatelets after angioplasty or after bypass or after having a heart attack, or you have some risk factors after the age of 55, please continue antiplatelet drugs. Don't stop it. Otherwise, you may get a clot tendency and you fall victim to vascular insult or vascular insufficiency. 7th S is sleep. Please sleep 6 to 8 hours. It looks very simple, but what I'm talking, there's a lot of in-depth science in it. And if you sleep adequately, your biochemistry is well maintained and your vulnerability for clot formation and inflammation is also reduced. Then have sattvic lifestyle. When I say sattvic, don't keep on consuming chicken and meat and eggs multiple times thinking you'll get strength. That's a misconception. Sattvic life means practice all the 8 limbs of yoga. Yama, Niyama, Asana, Pranayam, Pratyahara, Dharana, Dhyana, and Samadhi. In other words, moderation is the key. Balance your lifestyle. That is an appropriate COVID behavior after COVID and meeting the future challenges in the years to come. And please follow important vaccination protocol as recommended by ICMR or Ministry of Health or WHO. Don't be scared of vaccination. It is going to give you life. So I think we have to understand that, and there should not be any confusion about it. 9th S is self-consumption of immunoboosters. You should know, India is the world capital of omega-3 fatty acid deficiency. World capital. And omega-3, if deficient, you are more prone to inflammation. So you must consume omega-3 fatty acids and take zinc, vitamin C, and vitamin D on a regular basis. It's a normal requirement. So you should take additional pills. You need to have vitamins to maintain your health. So this concept is coming only after COVID. So we're becoming more wiser that we need to consume vitamins and omega-3 fatty acids, which is very, very important. And last but not the least, self-understanding of the need of vaccinations, which is the most powerful tool and protocol as per the guidelines of various organizations like CDC from USA, ICMR from India, WHO from the world, and Ministry of Health from every country. We should follow their protocols. They are going to eradicate COVID from our planet the way smallpox has been eradicated, the way polio. They are viruses. They have been eradicated.
Health, fitness.